recording right now. Before we get to our topic of self-care, I'm just going to bring up a couple announcements about today's upcoming events. Next week is National Public Health Week, and NACHW is hosting 4 different webinars on various topics, ranging from the APHA CHW Section Policy Proposal, a webinar on community health worker approaches in refugee and immigrant health and well-being, a webinar on Medicaid managed care organizations supporting CHW, and a training on how community health workers can recognize and respond to domestic violence. That will all be happening next week. These events are free and open for the public, and we hope you will join us. And to register for any of those, you can go to nachwa.org/events. NACHW is also doing a joint webinar in a few weeks on April 11th around child tax care credit and how you can figure out for yourself or for your clients how to obtain this credit before tax season is up. I also want to give a big shout out to our annual Unity Conference. This is a conference NACHW has been having each year in the summer for several years now. We have our save the date for August 3rd and 4th. This conference is going to be completely free for NACHW CHW members, and we expect registration to go live at the beginning of May. And I see people are joining us right now. So once again, I'll introduce myself. My name's Aurora Grant Wingate. I work for NACHW, or the National Association of Community Health Workers, for the past year and a half as their member and partner engagement associate. Thank you so much all for joining us here. I know it's late in the day for many of us for a webinar on self-care strategies for community health workers. This is a topic that is very important to us, and we know it's important to so many of our members right now. This webinar is born out of some of the work we have done around our learning collaboratives, where CHWs from different expertise and walk of life come together to talk around different topics. In January, we had one all around self-care and mental health, and folks were really requesting more information and resources on self-care strategies. And with that, I am going to introduce our speaker for today, Ashley Rodriguez. Ashley is an experiential CHW and CHW instructor with over 14 years experience in community and public health. Ashley is currently the Community Health Worker Systems Manager at Bayer Scott & White Health System. In her current role, Ashley is responsible for promoting and driving underserved and community health-focused projects, as well as develop new and innovative program applications for CHWs. Ashley serves as the APHA CHW Section Chair. She is a founding member and currently serves as the President of the Board of Directors for the Texas Association of Promotoras and CHWs. Ashley's passion is to build partnerships that support, promote, and elevate CHWs, as well as teach continuing education to CHWs across Texas and nationally. Once again, thank you so much for being here, Ashley. Take it away.
Thank you, Aurora, for that introduction. Good afternoon, everyone. I guess I don't really need to introduce myself. It was taken care of for me. But before we begin, I just want to have a brief disclaimer that I'm not a mental health professional by any means. I didn't realize I had already clicked through. I just feel like it's important to state that I'm well versed in CHW practices, and I am a community health worker instructor as well. So I have over a decade of experience and have developed and taught several versions of today's course. But I believe that my unique perspective as a CHW on the topic of self-care will hopefully you'll find it helpful. But all of today's content is just for informational purposes. This is not going to replace any professional judgment of your own mental health provider. So be sure to consult a licensed mental health professional for individual questions. Thank you. I feel like I don't like to spend a lot of time on objectives, but I do want you to know that today, not only will you be able to better understand stress, these buzzwords that we often hear around resiliency and emotional wellness, which are all those common terms that we're hearing, but hopefully I'll be able to better demonstrate the importance of self-care, help you to formulate what that looks like for you as an individual, and share a few tools. And we'll also explore some common pitfalls of self-care that are often not addressed or talked about, especially in webinars around this topic. All right, so everyone feels stressed from time to time, right? But when we talk about what stress is and what it does and how it affects your health, and more importantly, what you can do about it, of course, stress is just your body's way of responding to any kind of demand or threat. So when you sense danger, whether it's real or imagined or perceived, the body's defenses kick into high gear in a rapid automated process known as that fight or flight reaction, or the stress response. And that stress response is really the body's way of protecting you. So every type of demand or stressor, which could be anything from exercise to work to school, major life changes or traumatic events can be stressful. And stress can really affect your health. So it's important to pay attention to how you deal with major and minor stress events so that you know when to seek help. So some quick 5 things that you should know is that, of course, stress affects everyone. It's not uncommon. It's simply a part of the human experience. However, not all stress is bad. There's also the good kind that's referred to as eustress, which helps you to be more competitive physically or to help prep for an exam. Or sometimes, not sure why someone's drawing on the screen. Anyway, sorry. But this type of stress can also be attributed to when you're starting a new job. So you may just have a little bit of that feeling of stress, but it's not necessarily negative. And long-term stress can actually harm your health in various ways, which we'll touch on here shortly. And there's many ways to manage this. I'm not here to tell you what that looks like, but rather just kind of unpack some of those areas. And last, if you're ever seriously overwhelmed by stress, be sure to ask for help from a mental health professional. All right, so as I just stated, stress affects everyone, and therefore everyone feels stressed in some capacity from time to time. So some people may cope with this stress more effectively or recover from stressful events more quickly, which we're going to talk about kind of why that is and what that type of resiliency looks like. But there's different types, and I think, you know, unpacking some of this can help us to better understand too those physical and mental health risks. So a stressor in itself could be a one-time or short-term occurrence, or it can be an occurrence that keeps happening over a long period of time, and just be a recurring incidence that you're having almost on a daily or weekly or possibly even monthly basis. And this stress can be brought out by a sudden negative change, which could include, you know, the loss of a job, divorce, or even illness, or, you know, discovering that you have a chronic illness. And there's also traumatic stress, which is experienced in an event like a major accident. I also got that we're having an echo. I can probably switch to phone audio, and that may help if you'll give me 2 seconds to do that. Is it okay, Aurora? I can do that live.
Yes, that's fine. Thank you.
I want people to be able to understand and hear. Give me 2 seconds. Mute myself on the webinar.
Meeting ID followed by pound. You entered 8978. This meeting ID does. Enter your participant ID. You are in the meeting now. There are more than 270 participants in the meeting. This meeting is being recorded.
Okay, I'm hoping that that's better.
Yes, that's great. Thank you.
Fantastic. Sorry, folks. I think we're all getting used to those technical difficulties. Okay, so continuing. Last but not least, traumatic stress is when there's an experience like a major accident, possibly being, you know, involved in war, assault, or even from a natural disaster. All right, so now I'm just going to ask you all, I know that you've been weighing in the chat where you're from. I see folks from all over the country. It's exciting to have you here. Now I just want to ask you, what are some examples of everyday or routine stress that maybe you experience? And I'll just wait a few paces for folks to plug into the chat so I can hear from you. Toddler tantrums, yeah. Running behind, deadlines, not enough sleep, absolutely. Getting in the door in the morning, competing priorities, traffic. Oh, traffic's a huge one, especially in North Texas.
financial, large workloads. Zoom meetings are very much a stressor in everyday life. Multitasking, money, waking up, frustrations, yes, life stressors in general. Oh, forgetting to eat is so relatable. I know that that's something that I've been working on. Yeah, it sounds like we can all relate to some very common routine stressors, right? And the reason that I ask this is because routine stress may be the hardest type of stress to notice at first. And this is in part because the sources of stress tend to be more constant, right? So if we're talking about traffic every day, getting to work on time, those kind of things, versus in cases of acute or traumatic stress, the body has no clear signal of really when to return to that normal functioning. And so over time, the continued strain on your body from routine stress may contribute to serious health problems, such as heart disease, high blood pressure, diabetes, or other illnesses, as well as mental disorders like depression or anxiety, which arguably those of you that are community health workers and promotoras are already kind of familiar, but this is just to kind of level set, right? So when we're talking about stress factors, responses, or stressors, they broadly fall into these 5 categories around physical stress, emotional, psychological, behavioral, or psychosocial stress, and then last but not least, spiritual. And so these are, already defined for you on your screen, but when we're talking about physical, of course, some of you talked about sleeplessness, right? It can also be other physical changes like having chronic headaches, feelings of nausea, just and on the opposite end of things, even a surge of energy. And then for emotional, it could be, any kind of uncertainty. If there's uncertainty with your job, if you're experiencing depression because maybe you've been indoors during this last winter season. And on the opposite end, at the very end, is satisfaction. That's what the U stress is going to look like. And then for cognitive, it can be all encompassing around worrying or having anxiety, doubting your abilities. But at the very end, on the positive side, on the U stress, is gratitude for, probably escaping any kind of harm or other issues like that. And then on the behavioral side, this is when we tend to see folks that withdraw from their family or friends. But on the opposite spectrum, the U stress side is building community, which arguably a lot of us are doing all the time, right? And then on spiritual, it could be feelings of alienation, weakening of your religious beliefs. But on the U stress side, the positive, the very last listing there is spiritual practices that may help to contribute to positive stress. So I probably already know this answer, but I'd just like to stick it out there so we can also talk through this. But can clients or patients that you serve cause stress? And feel free to share your thoughts on that in the chat, because I've seen some interesting things when I've posed this question before. Yes, we see a lot of yeses, absolutely. I've actually heard from some folks like, no, they don't cause any stress. I love supporting them, but I do feel fatigued. And then the reason that I do this is because I've actually heard some folks that say, oh, see, I have one in there too. They give me a purpose. So yes and no. We're hearing, kind of the same things, that sometimes clients are also providing you with that positivity, right? But yeah, sometimes it can be difficult to deal with demanding clients or patients, especially if we're talking about working with folks that are in declining health. Maybe they're at the end of life. Maybe you're working with clients or patients that are depressed, or you're witnessing discrimination, right? And so that's causing you distress as well. Okay, so let's talk about this long-term stress and how it can harm your health. And yes, I think you guys can get a copy of the slides. I don't mind sharing them, so if there's a way for Aurora to share them, I'm more than happy. I saw that in a few of the comments. So many of you probably already know what some of the effects are on the body, especially, again, if you work with patients or clients that have chronic health conditions. But just in case, health problems can occur if that stress response goes on for too long, or it becomes chronic, such as when that source of stress is constant, like we talked about earlier. If the response continues after the danger is subsided, or with chronic stress, those same life-saving responses in your body can suppress your immunity. They can affect your digestive system. They, of course, can affect your sleep, but also reproductive systems, which can cause them to stop working normally. And different people may feel stress in different ways. Obviously, but again, if you're somebody that has experienced digestive issues, while others, if you're talking to your colleagues or friends or even loved ones, maybe they have chronic headaches or that sleeplessness. But people that are under chronic stress are more prone and more frequent to viral infections, such as the flu or common cold. And this image just shows a few of those ways. So I'll definitely make sure that you kind of get this image. I think it's very helpful, especially because there's so many times that people have said, I never really thought about some of these things that I've been experiencing being related to chronic stress. So that's interesting. So that's why I share it. It's not that you wouldn't know this. Also, let's talk about burnout. So now that you're kind of well-versed in understanding stress, I promise we're going to get to the self-care piece of things, but let's explore this other term you've often heard. And although this term may be used interchangeably in conversation, I'm hoping that's not on my end. Okay. Although this may be used interchangeably in conversation, burnout may actually be the result of unrelenting stress. So although they're related, it isn't the same. Stress by and large involves simply just too much of anything. Just think of it in that kind of bucket. So it could be from too many pressures, too many demands. A lot of you were talking about competing priorities, deadlines. That would fall into that bucket of too much, right? That's the stress bucket. And so people that are stressed may imagine that, you know, if you can get everything under control, you might feel better. Whereas burnout, on the other hand, is really not having enough. So being burned out has that feeling of emptiness. You may feel more mentally exhausted, devoid of motivation, or being at a point where you feel beyond caring, which is scary, right? And so people that are experiencing burnout often don't see any hope or positive change in their current situation. And it's important to make that distinction because if you're talking about excessive stress, feeling like you're drowning in something, then burnout is more of a sense of being all dried up. Again, not having enough. And while you're usually aware of being under a lot of stress, you don't always notice burnout when it happens. And that's why I wanted to touch on it. So I know now that you understand the different types of stress and burnout and their causes and their effects, you're like, okay, but what can I do to take care of my distress, my burnout? How can I care for myself? You know, I want to share a few ways that you probably already work on or are aware of, but hopefully I can touch on some new things to help us decrease those stressors and your burnout. In terms of, you know, some healthy ways to cope with stress and burnout, I share this with the caveat of, I'm sure you're already familiar with this. So I'm not going to share a bunch of stuff that you already know. Hopefully I'll highlight some new things, get you to, you know, those gears to keep running and think about what it looks like for you. But simply, it starts by just taking care of yourself. So of course, eating healthy, well-balanced meals. I can't stress enough how much your digestive gut can play into your mood overall, how it can contribute to stressors and decrease them. Same with getting exercise. And exercise doesn't always mean like going to a gym. There's simple things you can do like walking, you know, just even stretching. You don't have to be a professional at yoga, but learning some yoga moves can help. Getting plenty of sleep, which we're going to touch on sleep a little bit more later on. And then also just giving yourself a break if you're feeling really stressed out. If news events, especially current news events, which could be anything from lifting mask mandates to, you know, the ongoing changes in the pandemic. If watching the news or listening to it regularly is causing you stress, also taking a break and a step back away from the news, maybe for that day, or maybe limiting your intake into that news. Not that you don't want to be informed, but it may be contributing to those chronic stressors that you're experiencing. Also, you know, even though these are just the basics, we're going to uncover what experts say to further do what you can to counter the stress, and we're going to get into emotional wellness. So typically I ask you what it is, but for today's webinar purposes, I'm just going to dive right in. So how you feel, of course, can affect your ability to carry out your everyday activities. They can affect your relationships and your overall mental health and well-being. So how you react to experiences and feelings can change over time, but emotional wellness is the ability to successfully handle life stresses and to adapt to change in difficult times. So today I'm going to go through 6 strategies for improving your emotional wellness. And again, please note that emotional wellness, emotional health may be used interchangeably throughout today's webinar. And then we all hear this term resiliency, but this one I am going to ask you, what does that mean? And you can just quickly plug into the chat what your understanding of what resiliency means, which we hear about all the time. I know people's gears are turning on, so I'll give them just a minute. Great. Ability to bounce back. That's the one you hear the most. Absolutely. Overcoming adversity. We do hear that. Adapting, pushing through. Yes. Bouncing back from stress, ability to adapt, ability to change. Absolutely. None of those are incorrect. And that's what it is. It's the true definition is the ability to adapt successfully in the face of stress and adversity. But what does that really mean, right? So all of these kind of definitions I'm going to pull up on the screen really are valid. So resiliency just means that you have fewer negative emotions, or you're able to bounce back and overcome from those difficulties faster. You know, positive emotions can really impact our lives. And these types of outcomes are not limited to one area of life, but rather span across every nook and cranny of our human experience. And studies show that they improve relationships not only in our workplace, they improve our ability to seek and have successful therapy and counseling. They help us in the classrooms if we're students, even as adult learners. They help us with our families, but they also help with individual development and fulfillment, and a sense of fulfillment. And we're going to discuss relationships in terms of social connection later on as well. So people that are emotionally well, experts say, have fewer negative emotions. And this quality is called resilience. That's what we're getting into, right? And so another sign of emotional wellness is also being able to hold on to positive emotions longer. And these colorful orbs that you're seeing on your screen are the 10 most commonly experienced positive emotions, which can help to build or produce resiliency. So if that's something that you've struggled with, I know I have. I'm sure it's in part, you know, upbringing. I'm sure it's in part our own negative wheel that just kind of spins a lot of times. It can be hard to get out of, right? But these positive emotions that can impact your life, again, span across every nook and cranny. And so let's take a look at some of these. I know the yellow one's kind of broken up, but inspiration. Oftentimes that alone can really help to develop and build that resiliency. Pride, not only in your work, but pride in who you are and what you do. Your interest, practicing gratitude. You know, there's a lot of information out there right now too about practicing gratitude, but also just awe, taking in the awe and the beauty of nature, or being in awe about your children or other things that are in your life, and then taking joy from that. Also finding amusement in things. These are all part of those positive emotions. We don't always hear it. We tend to just lump it into a bucket of happiness. But I think having terms like this can really help you to better identify what those positive emotions look like for you and areas that you can focus on. So now I'm going to ask you briefly, what do you think traits of resilient people look like based on what I just shared? If we were talking about traits as you as an individual, or others that you look to as somebody that you think is emotionally resilient. Good self-care habits, joyful, their perspective, the ability to self-examine, hopeful. I'm seeing a few happies too and positive. That's always interesting to me. But yeah, I mean, all of these are valid. I think that's great. And what we know from research is that those who master resilience tend to not only be skilled in preparing for emotional emergencies, if you will, but they are also adept at accepting what comes at them with flexibility rather than rigidity. So taking in that tough time and knowing that there's a way that it's going to get better, even if they can't see it at the time. So resilient people understand that there's a separation between who they are at their core and the cause of their temporary suffering. And this can encompass any of these, but this comes from a Psychology Today article about how resilient people know their boundaries. I think that's something that, generally speaking, in my experience as a CHW, we can struggle with. There can be a really fine line between our boundaries with our patients and clients that we serve, with our communities, even with our own teams. But we do tend to try to keep good company, right? Folks that lift us up. But also, I think a lot of you touched on this in the comments too, in being self-aware, but cultivating that self-awareness, but also practicing acceptance, which I'm going to talk about a little bit more later on. And something that I have learned to practice is willing to sit in silence, not feeling like I have to fill in that space. And also not always having the answers, right? The great thing about being a promotora or community health worker is finding those other subject matter experts, those other resources in the community that you can rely on, and knowing that it doesn't always all have to fall on you. But also having a menu of self-care habits, right? So we'll unpack some of that a little bit later on too. And then enlisting your team. So whether that's your friends as your team, your colleagues as your team, but really going to that team when you need support. and always considering the possibilities of where things can take you, looking at things as more of like a learning lesson, if you will, especially when it's really difficult or tough situation, whether it's work or personal, and then trying to get out of your head. And there's a series of ways that you can do that. So in terms of setting and maintaining boundaries, those who struggle like I do to set those boundaries, there's 5 simple ways to get started. First, just start really small. If you feel overwhelmed, then build these boundaries slowly. This will allow you time to reflect on whether or not they're heading in the right direction, also whether you want to attempt to set them early. So if this is a new relationship with an individual or an organization, sometimes it can be difficult to backtrack and change that later. So setting those boundaries or expectations at the beginning with anyone in a relationship can really allow everyone to know where they stand and help eliminate confusion, frustration, or feelings of being hurt later on. And a huge part of setting boundaries is being able to say no, right? I think that generally women, Latinas, we struggle with this because a big part of, I know my culture is we have to say yes and we have to be agreeable. And so it can be difficult, but again, this can apply to friends, family, and especially even at work. You should feel comfortable of knowing when you can set those boundaries and say no, like, no, not right now, I can't take this on, and here's why. And also when we think about being consistent, so this will help to reinforce any of your original messages. If you've already said no or you've set boundaries, just making sure that you're reinforcing those messages. And for your boundaries to have a strong foundation, you really have to show yourself a lot of love and change that narrative in your head, because not having boundaries can be detrimental to your own personal mental health, but again, they can start to impact your relationships, your overall emotional well-being, possibly your families as well. And so you're much more intuitive than you probably know. So taking the time to really look at what setting those boundaries looks like for you. So that gets me into practicing acceptance. One of the key things underlying acceptance is that difficult emotions are, of course, a part of life. And so in order to be more accepting of yourself, consider reflecting on your habitual attitude about your own individual self and decide to just be more gentle, be more forgiving, help to cultivate the acceptance by noticing your own resistance, questioning your own patterns, being more mindful generally and considering what that sense of meaning to accept something really is. I often tell folks, think about the way that you treat your patients, your clients, your team members. If you wouldn't treat them that way, then maybe don't treat yourself that way either, right? Don't say those things about yourself. Taking a stance of being non-judgmental and actively embracing your thoughts and feelings or whatever might be going on in your body when these things occur. Really paying attention to, are you feeling stress in your shoulders when you're interacting, or trying to manage something and not being as forgiving with yourself if you make a mistake or those kind of things. And also, your experience of yourself largely consists of your emotions and your actions. So learning to accept them, even when they're undesirable, is helpful too for your general well-being. If you're speaking to yourself harshly and saying things like, oh, I'm so stupid. Why did I do that? What's wrong with me? These are signs that you need to take a more gentle attitude and just really focus on noticing your resistance so that it doesn't become habitual. Ask yourself if you think experiences you might have that might have influenced the way you process your emotions, maybe writing down your reflections to remind yourself of those patterns, becoming more aware. That can help with that mindfulness piece. And to keep in mind that acceptance is not resignation of, any behaviors or just accepting things as they are. It's really more about acknowledging and allowing your present experience and not necessarily reflecting on your whole life's work or your whole life situation, right? It's just a temporary moment in time. So now I'm going to get into these 6 strategies for improving your emotional wellness. Everything that I'm talking through today is taken from the National Institutes of Health Emotional Wellness Toolkit, which is freely available. You can download it. They've got these great PDFs and handouts that you can have and share with community members, your clients, your other team members, folks that weren't able to attend today. But we're going to go into each of these in depth, so I'm not going to read them out right now, but we're going to start with brightening your outlook. So one of the ways you can explore this emotional wellness piece is, again, we talked about how, experts say that people who are emotionally well have fewer negative emotions and are able to bounce back, right? And so in order to develop a more positive mindset and brighten your outlook, it doesn't just mean be happy or think positive. It's more of remembering your good deeds. So giving yourself credit for the good things that you do for others every day. It's also part of, again, forgiving yourself. I kind of touched on this before, right? But remembering everyone makes mistakes. You've got to learn with what went wrong and try not to dwell on it. Also spending more time with your friends, surrounding yourself with positive, healthy people that help you feel good, just like you help them. And also exploring your beliefs about the meaning and purpose of life. You'd be surprised, but experts say that the way that you think about how you guide your life or by your own principles are really important to you, but you often probably don't spend time really thinking that through and exploring that and deciding what that looks like for you now. And of course, we touch on this all the time as CHWs, as promotoras, as individuals that are serving communities, especially when we're tasked with health-focused projects or areas, is developing healthy physical habits. And this can be, your eating, your physical activity, that regular sleep, the same things that we often teach our patients and our clients. Okay, so for strategy 2, as I said before, stress is a part of life, of course, to say the least. But there's a few simple ways that you can reduce those stressors, and that includes getting enough sleep. I'm going to talk a little bit more about how you can do that, I think, in the next slide or two. When we talk about exercising regularly, we all know this too. It's just 30 minutes a day of walking. It doesn't even have to be high intensity, even though everyone would like it to be. That just walking alone can boost your mood and reduce stress. But also building a social support network. So if you're not sure who you would go to for, a personal tragedy, or who you should go to talk about work things that maybe isn't on your direct team, those kind of things, start thinking about what that really looks like for you. Where are those areas of emotional and social support? Maybe it's also not talking about it, but kind of getting outdoors, right? Walking together, doing things that are social. And also setting priorities, deciding what must get done and what are those things that can really wait. Like maybe you are stressed about the dishes, but you know that you could also wash them tomorrow and it wouldn't be the end of the world, right? So taking some of those things off of your plate. And remembering, even when it comes to work, saying no to new tasks is okay if it's putting you into overload. Really talking to your supervisor, your team lead about that is going to be really key. It's part of you setting your priorities professionally. And again, focusing on positive. Note what you accomplished at the end of the day, not the things that didn't get done. Don't focus on any failures in terms of failure. Think of it as a learning opportunity, some area that you need to grow in. Also, you can try relaxation methods. There's so much free content out there on YouTube, via Google, everywhere on practicing mindfulness. There's meditation. You can also do yoga or even Tai Chi if that's your thing. There's so many things out there to do to relax your body and relax your mind. And of course, talk to a mental health professional if you're feeling that you really are unable to cope, if you're having suicidal thoughts, if you feel that you are severely depressed, or if you've noticed that you're turning to drugs or alcohol to cope. Okay, so often we sacrifice our sleep generally, right? It's the last thing on our list. We've got all this other stuff to do. Sleep is not a priority, but sleep can really affect your mental and physical health, and it's vital to your overall well-being. So when you're tired, of course, you can't function at your best. Sleep is going to help you think more clearly, have quicker reflexes, and focus better. So you really want to take those steps to make sure that you get a regularly good night's rest. And in order to get a better quality sleep, experts say you want to try to go to bed at the same time each night and get up at the same time each morning. That may not be under your control if you have little ones, right? Or maybe you have live-in roommates, or maybe you're part of a multi-generational family and you're, balancing everyone's needs in the household, which I totally understand. That's ideal state, okay? If you can't do that, also trying to sleep in a dark, quiet, comfortable environment. But also experts say that exercising daily can help, but just not doing it right before bedtime, because then it gets your heart pumping, it gets your mind going, and it can be harder to fall and stay asleep. You also want to limit the use of electronics before bed. I know that I've been practicing this since before the pandemic. I really do turn off all the notifications on my phone. I plug it in and I set it aside and I don't touch it when I'm getting into bed, because otherwise that blue light keeps me up. I don't get as much rest. but also just trying to relax before bedtime. So similar to what we do to small children, having a warm bath or a shower, reading a book might help. I mean, going back to basics, really simple steps that you can take. And also you want to try to avoid any alcohol or stimulants such as caffeine late in the day. I know I personally am very sensitive to caffeine, so I don't drink anything after noon or I won't sleep. I'm like a small child. Also avoiding nicotine can help. And then of course, if you've tried all of these things and you're still struggling, definitely consult your healthcare professional if you have ongoing sleep problems, because it could be a signal that there's other things going on. So the next strategy from NIH is around coping with loss. So of course, when someone you love dies, your world changes. I'm sure that many of you have lost people during the pandemic. My heart goes out to you. I hope this is not triggering in any way. And there's no right or wrong way to mourn. And although the death of a loved one can feel overwhelming, most people generally can make it through the grieving process with support of family and friends and to learn healthy ways to cope. So some of this healthy, things that the NIH recommends is, of course, generally taking care of yourself, trying to eat right, trying to get that exercise, trying to get enough sleep, avoiding bad habits like smoking and drinking that can put you at health risk. Talking to caring friends. If you know that there's folks that will allow you a safe space to talk and just listen, go to them. And if they're exhausted, hopefully they have boundaries they can set with you and say, hey, I'm not the one for you today, but I love you and I'm here for you. It's a bit much for me right now, and vice versa. Also finding a support group, a grief group. There's so many options now with this virtual world. There are, Facebook groups. There are also like Slack channel teams, and there's so many opportunities out there. So you don't have to be as limited as I think previous to the pandemic. I guess it's one silver lining that came out of it. But it can really help to talk with others who are also grieving. Also remember not to make major changes. So wait a while before making big decisions like moving or changing jobs if you're currently grieving. Make sure that you're talking to your doctor if you're having trouble with everyday activities. And of course, always consider additional support because sometimes short-term talk therapy can really help. But most of all, be patient. Mourning can take a lot of time. And it's common to have a roller coaster of emotions for a while when you're experiencing this. Here's a few grief support resources that are available nationally. Again, I think you all will get a copy of the slides. I'm not sure why this logo hasn't come up. But from Grief Share to the Grief and Loss Center, their motto is Hope After Loss, and then also Journey of Hope. And then there's Lighthouse, and then the LGBT Aging Center has fantastic resources for grief support. So strategy 5 is all about strengthening your social connections. This can help to protect and lengthen your life. Scientists are finding that links to others can have powerful effects on our health, both emotionally and physically. And I'm sure for those of you that are working with isolated patients and clients, you're seeing this in real time, right? When you're meeting with them, I'm sure it can change their entire day and change their health trajectory. So whether this is with your romantic partners, your spouses, family, friends, neighbors, or others, just maybe there's folks from a coalition that you regularly meet up with. Those social connections can really influence your biology and well-being. And to build healthy support systems, this looks like, building strong relationships with your kids, getting active and sharing those healthy habits with your friends and family. If you're a family caregiver, asking for help from others and not taking it all on. You can also join a group that's focused on your favorite hobby, such as reading, hiking, painting. There's there's probably Facebook groups for just about everything out there. And outside of Facebook, there's others too, right? There's meetup groups. There's so many out there. You can also just try to take a class to learn something new. Sometimes there's free classes in your area too. It could be from your local rec center. It doesn't have to be virtual unless that's what you prefer to feel safe. And there's also things you can volunteer for that can fulfill your life's purpose and strengthen those social connections. It could be, at a community garden, at the school, at the library, at a place of worship. And although this isn't always, feasible for everyone, especially considering a lot of financial constraints that the pandemic has brought about, but traveling to different places and meeting new people can weigh in that area as well. And the sixth strategy, even though we kind of touched on this earlier, I can't stress enough how critical being mindful really is, which is the final strategy that NIH shares. And so I just want to ask you quickly, who really knows, has heard of being mindful or knows what it means? And I'll wait for a few comments in the chat. Being aware, being present, living in the present moment. Absolutely. Yes. Being aware of your feelings, your environment, your triggers. Great answers. Thank you so much. Yeah, staying still, observing. Absolutely. The concept of mindfulness is simple. This ancient practice is about being completely aware of what's happening in the present moment, all that's going on inside of you, all that's happening around you. It means not living your life on autopilot. I think a lot of us find ourselves there when we're running from work, picking up the kids or taking care of our mother or grandmother, and we're going through the motions. But becoming a more mindful person really requires commitment and practice. And there's a few tips to help you get started. So this can start with just taking deep breaths. So we're going to do that. Hopefully you're going to do it with me together. The best way to do a deep breath is to go in through your nose, breathe in through your nose and out through your mouth. You can hold it for however many seconds. There's all different types of practices, but for today's purposes, we're just going to breathe in and breathe out. That alone is a form of mindfulness, and doing it in repetition for different sets can really help to relax your heart rate, to relax your muscles, especially if you're like me and you're tense like this all the time because you're typing all day. Those deep breaths can really help you to practice a small form of mindfulness. You can also just enjoy a quick stroll. So as you walk, you can notice your breath, the sights and sounds around you. Maybe not plug in with your ear pods on that walk, and just kind of take in the sounds of your city or your neighborhood. And as you do, you might notice that your thoughts and worries might tend to enter your mind, but returning into the present, taking in what you see, maybe mentally you're saying, okay, I want to name 5 things that I see. That's going to take you out of those negative thoughts. Thinking about things that you smell, that you hear, that you can touch. Those are practices that are given from counselors to people that suffer from anxiety, and again, those repetitive negative thoughts. Also, practicing mindful eating. We're starting to hear more about this, and those of you that are chronic disease educators or working with patients that experience diabetes are probably also talking to your patients and clients about that. Being aware of the taste and the texture and the flavors of each bite, and also listening to your body when you're really hungry and when you're really full. And then last but not least, there's a ton of mindfulness resources in your local community. That can include yoga, it could include meditation classes, even mindfulness-based stress reduction programs, and then of course books. Going to your local library, you can probably find a ton of information on practicing mindfulness on your own. All right, so some of you may be feeling, okay, but what if our stress and what if all these negative thoughts, all these things, what if it's mostly work-related? What are you supposed to do then? So whether you have a job that leaves you feeling rushed off your feet or one that's more monotonous or maybe right now it's feeling like unfulfilling, the most effective way to combat that job burnout, of course, is to just quit and find a job you love instead, right? That's not always practical, and it may not even really be a solution. So of course, for many of us, it's far from practical. We're just grateful that we have the work that we do, that we can pay our bills, that we're making an income, right? But whatever your situation, the steps that you can take is really to improve your state of mind, reframe the way that you look and feel about work. And this starts with trying to find value in your work if you're struggling. Even in the most mundane jobs, even if you have to really take a look at what you're doing as opposed to what you thought you would be doing or maybe what you were hired for, really focus in on how your role helps others, whether it's within your own organization or agency or the greater community. Focus on those aspects of the job that you do enjoy, even if it's just chatting with your coworkers at lunch. That can really make all the difference in your work day and in your work week. Changing your attitude towards your job can also help you to regain a sense of purpose and control. Another thing you can do is find balance in your life. And this means, if you're not enjoying your job right now for a number of factors that may be out of your control, Look for meaning and satisfaction elsewhere in your life. Look to your family, look to your friends, your hobbies, your volunteer work. Focus on those parts of your life that bring you joy, which we're going to talk about balance, I think, in a couple other ways, but just really thinking through what that looks like for you. And then making friends at work. You know, having those strong ties in the workplace can really help to reduce the monotony, to counter any effects of burnout. Having those folks on your team that you can chat and joke with during the day or relieve stress from an unfulfilling or demanding situation or project can not only help to improve your job performance, but simply to get you through a rough day. And then, of course, taking time off to recharge. So if burnout seems inevitable, try to take a complete break from work. You know, take your lunch breaks, take those 15-minute like walking breaks. Use your PTO, go on vacation, take a staycation, just have the day off. Anything to remove yourself from the situation more often, and step away, and then using that time to recharge your batteries and pursue other methods of recovery. So we did get in the question with registration, you know, for those of you that may be CHW allies or supervisors or team leads, remember that role doesn't just mean to always talk about and discuss or keep a pulse on projects and the work. It also means keeping in touch with any challenges your team or your staff is experiencing professionally or personally. You can be a resource. Oftentimes you can connect that team or that individual with internal resources like an employee assistance program if you feel or they feel like it's needed. Maybe there's a counseling hotline that's available, or even just other staff and other departments that they might not have thought to reach out to for support. And you supporting them and taking those needed breaks, encouraging them to use PTO. Because after all, you want your team to feel successful and you want to be able for them to come to you to discuss those self-care needs. Which brings me in to self-care tips. So now that you not only have the 6 strategies for self-care, here's a few quick tips to help keep stress at bay and for general self-care. You know, we often tend to think, especially in the United States, as the spending money on things like getting your nails done, getting your hair done, shop therapy. But there's so many other free options that just take time, not necessarily dollars. So this can include just avoiding drugs and alcohol. They may be seeming like a temporary fix, but in the long run, they can create more problems or add to your stress instead of taking it away. You want to, of course, find support. That can be seeking help from your partner, a family member, a friend, a counselor, a doctor, or a clergy person. You know, having someone with that sympathetic ear can really help to lighten the burden. We've talked a lot today about connecting socially, but especially after a stressful event, it can be really easy to isolate yourself or shut people out. But make sure that you're taking the time to spend time with loved ones. Consider planning activities with your partner, your kids, your friends, which also leads into, you know, remembering to be active. I love to share this. I feel like, you know, when I hear exercise, if you're like me, I kind of like shut down and I'm like, I'm probably not going to do that. But dancing can be exercise too. You know, studies show that dancing is not only, of course, personally fulfilling and joyful, but it can reduce disease burden like dementia, just dancing, which is considered exercise. And now I'm just going to kind of ask you all too, I mean, based on this list here, who remembers some of the things we talked about earlier for taking care of yourself? Some of them are on here, but some of them are a little different. Just see what you weigh in. How you can support someone. Okay. Yeah, I mean, some of the other things when we're talking about taking care of yourself, yes, getting sleep, being mindful, yes, absolutely. Giving yourself breaks, eating healthy, well-balanced diets, yes. And when we're talking about staying active too, these activities could include helping a neighbor, right? It could just be like, oh, I'm going to bring in their mail or their paper, or I'm going to go check on them. Volunteering in your community, taking your dog on a walk. All of these can be positive ways to cope with stressful feelings. So this also brings me to self-care from other cultures. So self-care may not only be based on individual preference, but it could also be based on your upbringing and culture. And cultures around the world have unique wellness practices and philosophies. This can be from laughing to napping, and I'm just going to talk about a few of these briefly because I know I'm getting to the end. But Denmark has, sorry, I'm getting a lot of feedback. Hopefully they can mute. Okay. There's this huga. It's this first word is pronounced If you all could just mute, okay. Hygge, which loosely translates as coziness. It basically is a word that's also synonymous with well-being. It captures all things that are cozy and warm and enjoyable, which could be from curling up to a soft blanket, to chatting with friends around a fire, to enjoying the warm glow of a candle. In Spain and other Mediterranean places, as well as Latin America and some places of Asia, there's also siestas, which are just an after lunch nap, right? And they take it so seriously that oftentimes they're shutting down entire businesses during the day. But researchers have found that, especially among Greek people, that those who partake in regular napping had a 37% lower chance of dying from heart disease. So it can't be underestimated. And then there's this Japanese forest bathing, which is not an actual swim, but it's more an immersion in nature. And it's loosely translated as forest bathing. And so this is more like a non-goal oriented activity. It's not hiking, it's not camping, it's not looking for anything, and it's not even looking for a special destination. It's simply finding a spot of nature and being around trees or in a garden and just taking in all of the beauty and enjoying the forest with your five senses. And then some of you may have heard of laughter therapy, which is a practice out of the country of India, and laughter yoga is often practiced in groups where real playfulness and interaction between people can turn into from practice laughs into real hearty guffaws. And even though laughter can start as fake, it actually has studies have been shown that it still helps tremendously with health and well-being. And then there's the South African philosophy of Ubuntu, and this is from the Zulu language that can mean humanity towards others. I feel like this is arguably the most CHW practice that I found, and I thought it was really great. But it's different from the other items on the list because it's not just a practice, but it's a whole humanist philosophy that embraces diversity, compassion, warmth, and dignity for all. And then last but not least, there's the Jewish day of rest and reflection known as Shabbat or Sabbath. And this religious tradition falls on the seventh day of the week, which can begin on a Friday and ends on a Sunday evening, which people refrain from work. So instead, they honor the Sabbath with restful activities like prayer, contemplation, and having festive meals with family. So I know we're running out of time, so I don't have a lot, but feel free to plug into the chat about what your culture does that we haven't touched on around self-care. In the slides, you're going to get this lovely little image. This is just a tool that I found on social media. That's something that you could easily recreate for yourself. What a simple concept, right? A self-care calendar. Maybe you're making one for the week with simple things that you enjoy doing to choose from. Maybe that helps you. And last but not least, because I have to get into this in the time that we have, is those 5 common pitfalls. So some of you may be surprised that self-care typically does involve other people. You don't have to do it all on your own. It's always acceptable to ask for help. It's one of the first pitfalls that most people experience. And although there's no right way to do it, everyone's self-care looks different in practice, which kind of leads me into you just committing the time to do it. Not all self-care is easy and not all self-care is fun, but putting in the time is going to make a world of difference. But also being cognizant that you're not overdoing it, like getting on to yourself that you didn't follow through with your self-care, right? So that's not the idea, not being critical of your own self-care needs. And then trying not to do too many things that you enjoy, right? So, and last but not least, just simply not worrying about it, not asking yourself like, oh, am I doing it right? Do I have enough time? Or I forgot to do that one thing I really wanted to do for myself. It genuinely defeats the purpose. So let me say this as plainly as I can. Worrying about self-care is not going to contribute to better self-care. So some signs that some more help may be needed. If you are trying to take steps on your own to lower your stress and it's not quite working out, you definitely want to talk to a professional if you're having symptoms of stress or feeling sad that lasts more than 2 weeks. If you're not being able to take care of yourself or your family, if you're not able to do your job or go to school because of stress, if you are utilizing alcohol or drug, or if you're thinking about suicide. So in closing thoughts, this is a picture of me during the first 6 months of the pandemic. My husband and I took a weekend-long road trip to the dubbed Texas Grand Canyon at Palo Duro State Park. We needed to get away from the screens. I needed to get out of our house. And our poor little Morkies that you see in the background, they needed it too. They were tired of being cooped up. So this is just one small example of something that I did to decompress and practice self-care. This doesn't mean that I didn't love my job or the work that I do. It simply means that I just was getting burned out by being indoors, and that's okay. So using the tools outlined today that I often teach to other CHWs helped me to identify what I needed during that time. And so now I'll close with this final thought, just to remember that when you take care of yourself, only then do you have the space and capacity to care for others. So be sure to keep that in mind. And with that, I know we don't have a lot of time for questions, but I'll see if Aurora has anything that came up in the chat.
Thank you so much, Ashley. I think that was really fantastic. The chat has been blowing up the whole time. I think you ended up answering most of the questions. One that I did see was from Camilla, who says, do you have any tips for organizations in fostering boundary settings for self-care and for CHWs?
Great question. I mean, it's going to depend on your organizational culture, right? But I would recommend maybe even just starting kind of a working group to explore what that looks like, depending on what type of organization you are. If you're in a healthcare setting, maybe working with behavioral health social workers, having community health workers and a physician come together and talk about what those self-care strategies could be that you all develop. Maybe you come up with a tip sheet, right, that gets pushed out. I know my healthcare system does great things like that all the time. They have also these webinars that are out of our employee health department where they can give you those tips and have experts on there. They may just be doing like a mindfulness class or a yoga class. Sometimes they do them in person too. So that just may be something that you will want to explore with different departments and get buy-in and build together.
Another I see is from Ambreen, and she wonders if you have any books that you would recommend on the topic.
Oh, there's so many great self-care books out there, right? There's not any that come to mind, but I think maybe I'll include some in the resources part of the slide deck that I give to Aurora that gets pushed out to everyone. I can include a book list with a few of my recommendations. Thanks for the question.
Okay, and I'm giving it one more second to see if any questions come through, but I'm mostly just seeing folks saying thank you. Yes, I will be sending out the slides and the recording in the next few days to everyone who registered. We really appreciate everyone taking the time to come be with us today and taking a moment for yourselves. And thank you, Ashley, so much for putting together this presentation and coming and being with us today. I will let you have the last word. Thank you so much, everyone.
Sure thing. I'm happy to be here. I appreciate NACHW giving me the opportunity. When I saw your call for topics, I knew that not only was this one that we see within Texas, that I see within my role within Baylor Scott White Health, but nationally, we need more self-care strategies as frontline staff that are really providing that support to communities. So I hope you all learned something new. We're happy, again, I'm happy to give the content to Aurora to push out to attendees, but it was my pleasure. The honor was all mine. I hope you all will take this and spread it and share it with your teams and come up with your own versions of this. I'm in no way a subject matter expert. It's just something I'm passionate about, but I appreciate it.
Thank you, Ashley. And folks, as you leave the call, we will have a survey pop up. It's just a couple questions that asks about how you like this webinar and what you'd like to see in the future. So we appreciate if you fill that out. If you're interested in seeing more from us, please visit our website, nachw.org. We got a ton of events coming up and we look forward to seeing you all soon. So thank you so much. Have a great rest of your night.